All right. Rant number 4, I guess I threw an extra rant. So student loans, unaffordable homes, medical debt. There's two things I'm talking about when I say medical debt. The first one is the literal, you take out loans to pay for a medical procedure. So the two examples I'll give, one, I've never had medical debt, fortunately, and it's a point of privilege. Um, I'd read that 20 million people in the US have some form of medical debt. 14 million people owe over $1,000, and then there's like a smaller percentage that owe over $10,000 in medical debt. This is, it's the kind of debt you take out because you didn't want to die, right? Like you didn't really probably have a choice. You took out medical debt, or in our case, we went through surrogacy. This is like over $100,000 to hire a surrogate to do the IVF, to make embryos, and it's such a point of privilege to be able to do that without taking on debt. But at the same time, like it just shows how commoditized medicine is in a country that everything's commoditized in. But medical debts, to me, like the other debt obligations, right? Like having a house, like you need somewhere to live. Not necessarily true, right? You could be homeless or live in your car. It's not great, but it's an option. But a lot of this medical debt is in the form of things like procedures that saved your life or the life of your kid. And if you're poor, you don't have a choice, right? Like you had to take on debt and loans to be able to do this. Um, I guess the third option is essentially you don't pay, and hospitals and systems have various ways of dealing with that. But most of them do their very best to push the cost back onto the person, right? Like if you're homeless, for example, today or the other day, it was probably yesterday, I was walking down the street and there was you know, an ambulance that was loading in a homeless person having some sort of health issue, right? They're not going to be able to pay anything. So that's some emergency budget that is essentially going to be a cost that's passed on to all the rest of us that can't pay. These are the people that are getting medical debt, or just folks like me that just have like an HSA and then a regular insurance plan that they're paying. We're we're paying for healthcare for the people that can't afford it and for the people that can, right? Like we have to pay essentially two buckets, right? There's the people with medical debt that are paying for themselves, over time. There's people paying insurance premiums, but the other side of it, and I think this is the completely fucked up part, is Medicare. And I probably would throw Medicaid in there too. Um, but I think Medicare is the problem. So according to something I'd read, 72% of unfunded obligations in the government go to Medicare. Unfunded obligations meaning they take in, a few $1 trillion, but it costs, I think it's going to be 9 trillion over a few years, and then it'll end up being 40 something trillion over the next whatever 20 years. This is not, it's not even unsustainable. It's just not fair. Like there was a time when there was no healthcare in the United States, right? Of any nationalized or local form, right? There were doctors. This isn't even that long ago, right? This is like maybe 100 years ago, maybe less than that. There were doctors or nurses or whatever they were, but they operated in capacities that were localized. And we've just flipped that, right? Everything's become centralized. You have places like Kaiser, you have big hospitals, and there's just tons and tons and tons of money thrown into these systems. And the outcomes are not very good in the US. Like for the G7 or for any like Western European comparisons, like our health outcomes aren't very good here, for especially for the amount that we spend, which is just an indication that the money is not going to help people, right? It's going to keep them sick. It's going to get drugs for them, expensive procedures, all sorts of costs, right, are coming into the picture, but not benefits for people. And Medicare is just the worst. Like, I think it's like it's kind of like a focus of all the things that I really dislike about this war on the young, or even war on like middle-aged people. Like, if you're over 65 or you're at an age where you get Medicare, you essentially have free reign, right? Your drugs can be paid for. My wife works at a pharmacy. They can get their supplements covered by Medicare, which doesn't, like, you can't do that with like normal, maybe with an HSA, but normal health plans don't cover that, right? Like a regular insurance plan. Um, the amount of people I see that are essentially on death's door, but that we are spending millions, billions, and now trillions of dollars to keep live and functional. Um, I think it just sickens me because we don't spend that money. Like, I could say Medicaid, right? That's the other one. Like, Medicaid is bad, but Medicaid's for like kids. Like, these are people that you want to grow up, right, and want to have full lives and stuff. And that if we spend the same amount of money that we do on kids as we did on adults, it would be another trillions of dollars. But I feel like it'd be so much more worth it. Like, the number is like 6 to 1, 7 to 1, sometimes 40 to 1 for the number of federal dollars spent on people over the age of 60, 65 versus kids. And it's like investment versus sunk cost, right? Like, these people that are old, right? I have grandparents in their 80s. My parents are in their late 50s. They'll be in their 60s. I don't want them to die. I don't want them to suffer all that stuff. But they have assets. These aren't poor people, right? I think the core problem is these people have a lot of resources already. And then on top of that, they're being given Social Security, which is one of the later ones, but this is very related, and Medicare. And Medicare is not funded. Like, there is not enough money going into the system. I pay, you know, what, some stupid amount of my paycheck. It's like 5%. And then over a certain threshold, if you make over 200K, you pay like an extra 1% that goes just to Medicare. And it's not enough at all. It's still like a huge shortfall. So, like, we're already paying a ton of money. There's a ton of deficit, and there's a ton of fraud. I mean, it's like 5 or 10% of Medicare spending does not equate to any form of care. Like, it's upcoding. There's all these, you can read about it. There's these shell company style offices that code for Medicare and bill for it and get paid, and they don't do anything. I So student loans and Medicare, which are medical debt, right? It's government funded debt. They just have the exact same problem, which is that the government controls the money supply. And so the government doesn't have to follow the rules. The US government does not follow the rules like states do. Like, if California doesn't have enough money, they can issue bonds like the federal government does, but they can't do it in a way that the federal government issues bonds. Like, when the federal government issues bonds, they actually increase the amount of cash that exists. Like, they print more money effectively. They don't actually do it anymore because we don't really print that much cash. They just like make a transaction on the ledgers of the treasury that say like this much more money exists and this much more treasuries exist. And they do that to fund the government because basically my entire life, basically since 2001, has been the story of printing, in quotes, printing money, generating money, creating money that doesn't exist to fund war programs, to fund Medicare. But on top of all of that, on top of all this debt servicing and all this debt creation, there is just crazy tax policy that is applied to fund these things that is also insufficient, which I think is pretty funny. That, like, despite the crazy tax burden that is levied specifically for Medicare, right? I mean, like, it's called out in your paycheck. If you get a paycheck, just look and see what's like FICA, right? Social Security, Medicare. Like, it's as significant as basically any part of your paycheck. I mean, obviously, if you make good money, then you get graduated income tax where you start getting taxed more and more and more. But that part is pretty constant. And Social Security phases out, but Medicare increases, which I think is funny over when you start making a certain, when you're privileged enough to make enough money, it goes up. Um, and it seems like a small round. It's like a percent, right? Or whatever it is. But this is money that you can't put in a house. You can't put in your bank account. You can't put in stocks. It's just poof, gone. It's gone to a program that does not care that it wastes a bunch of money, that does not care that it doesn't have enough money to pay for all these people. Like there's like a radical indifference on the part of the federal government, the people that run the federal government, which I will implicate all of Congress, the executive branch, all these politicians of either flavor. Neither Democrats nor Republicans have done anything to even sort of fix Medicare. We can argue, you can talk about the Affordable Care Act / Obamacare, but it was essentially an attempt to try and give more people health care. But the system only benefits from that if, there was this thing called the individual mandate where basically some people had to get health care or they got taxed or punished. They got rid of that. So essentially they're just adding more people to the program that already did not sustain itself and work with the people that were in the program, right? Like there was not enough money for Medicare before. It's not like it's only been the last year or two that it's been in deficit. I'm sure it's been in deficit for years now. And adding more people to a system that has been pegged, there's a number of doctors that can get what they call residencies in the U.S. and they were worried that there would be too many doctors, so they clamped the number to like some percent, and it's grown like this. But the number of people that are basically in need of medical care has grown like this because the boomers are all entering these years where they're, old and sick. And it's funny that these costs go up so high because like so much of this is privatized, so you would assume that like privatization would fix things. Like that's so much of Republicans or people on the right's pitch, right? Is like private systems fix these issues. But I think we just have the worst of both worlds, right? We have like private institutions that want to make a lot of money, and then public institutions that can literally print dollars to fund those institutions. And so you get things like PBMs. We can look at those up, pharmacy benefit managers. Essentially, it's a monopoly scheme where the insurance companies and the pharmacies and the pharmaceutical companies all kind of fall under one umbrella, and they buy drugs from each other that they set the price for, and they set the price really high to keep out other people from servicing the drugs. So like all these weird amounts of costs fly around that you don't necessarily have to pay, but then if you ever see a sheet, like your drug will be, like a pharmaceutical drug will be worth like hundreds of dollars or thousands of dollars. But then like the insurance pays it, but they're paying it to themselves. And they're doing all of this to essentially maintain the monopoly and maintain like a crazy amount of cash flow their way. And arguably they wouldn't be able to get away with it if it was completely private. I mean, maybe they would, but arguably they wouldn't, because people would be like, I'm not paying for that. And so they would just fold. But because they're backstopped by things like Medicare, and there's Medicare Part D, you can read it. Essentially, like the government has no bargaining power. And I know Trump and Biden have both argued that like, hey, we're going to bargain for the cost of these drugs, but they don't, because they don't really have power, right? The companies are running this stuff. And the companies and old people are running this stuff. Like specifically like people that are in their 50s and beyond, who are not really people in their 50s. It's really people in their 60s and beyond that are running the government and deciding to push dollars more their way. One thing for medical debt, like probably the best example that people will be aware of in their lives is things like COVID-19, where an insane amount of money was pumped into the economy, right? Like trillions of dollars, while the economy was cratering because people couldn't work and were getting laid off and stuff like that. But that money didn't go to like working class everyday people, right? It mostly went to older people, because working class everyday people, if they received that money, They were either A, paying taxes on it, or B, spending it. The older people don't have expenses, right? They own their homes. Their healthcare is paid for, and that would be their expense, right? They have Social Security, so they have an income. So they just kept that money. It's just in bank accounts and not Social Security, but stock accounts, whatever it is. There's billions, trillions of dollars that just were set aside for older people. And the cost, I think the cost of COVID-19 for most people was that it was kind of like a blip where you didn't really get to live like a normal life for a period of time. Um, I think this gets so political, the vaccine stuff. I got the vaccine and all that. I'm not going to argue against that. My argument is more the people that were hurt the most, I think, were kids. Like, I was fortunate that my daughter was very young or not even born yet, but I have a nephew who was in elementary school, and he just seems so devastated by having to be at home. Like, he's like a third grader or fourth grader. I mean, I feel like it like knocked him out for years. Like, he did not recover and was not the same kid for years because there was all this fear mongering, there was all this stay at home, there was all this stuff that may be valid. People are getting sick, people are dying, but I think the most affected people were elderly people, and to put kids' lives on hold and pump a lot of money into the economy and give it to old people. And in my opinion, it wasn't just putting kids' lives on hold. It was essentially ruining some experience for them, right? I know kids that were in high school that were graduating. They didn't get to graduate and walk. They got to put a mask on and get handed a diploma in a line of cars. I knew people that were graduating college. They didn't have the college graduation, right? These are like seminal events that didn't happen. I mean, if you're a 65-year-old person, what your seminal event is death, right? Or watching something happen to your kids. Like, it's it's just it's unfair. It's very unfair. So much to the point that I don't blame younger people from just doing bad shit at this point. Like, when I remember seeing this is so anecdotal. I remember seeing some guy shoplift and steal like a 12 pack of like some sort of spiked seltzer. And I was just like, oh, he's stealing, da da da. I think I let someone know. And then I was like, you know what? Fuck this grocery store and this whole, because this is all during COVID, right? So all these institutions that are pretending like they can just treat these kids like furniture and that they're not people and that they don't have experiences and lives that are essentially they are not getting deferred. They're getting canceled, right? They didn't get to have their graduation 2 years later. It didn't happen. People had weddings. They canceled their weddings. Maybe they had them later, or maybe they split up because people were all stuck together. Got to really figure out if they liked each other or not. There's different types of debt. Like, medical debt is not just financial, right? The COVID-19 is was a societal debt. We decided that kids and younger people's lives were not as important as the lives of the elderly. And we've been making that choice over and over in this country through my life, that old people matter more and are more important. Right now with AI, there's this huge hiring freeze where entry level people aren't going to get hired because we're just going to use AI instead, which is fucking stupid because in 10 or 20 years, who's going to be doing any of the work? It's all going to be AI. It's just, young people need to be trained to do things. People need to be able to do something. That I think the more that we decide to crush young people with debt, with not letting them do things, helicopter parenting, COVID restriction style stuff, you're just waiting for a powder keg to blow up. You know what young people are really good at doing? Taking guns and killing people. That is their skill, right? Who's in the military? It's not 80-year-olds, it's 20-year-olds. And you can't keep punching down and expecting something different. I think or expecting the same thing. I think we will see. I suspect in my lifetime, if this punching down continues from old people on the part of financial fuckery, that there's just going to be some crazy reckoning. And medical debt is like one of the worst things to end. Like Luigi Mangione, right? He shoots a CEO. This is like, oh, it's the CEO's fault or it's the healthcare system's fault, right? People were like so like praised him, and I think that I will always say that companies can be fuckers, but that's a lot of how this works. I have to remember that the companies are supposed to be checked by politicians, and those politicians are not doing their jobs. They're not checking these institutions. They're not creating a fair system where billions or trillions of dollars are being funneled to old people at the cost of young people. They are enabling and creating that system. And medical debt's probably the epitome of it. It's the amount of Luigi Mangionis that exist in this world that are willing to do something dangerous and violent, I think will go up as disparity increases. Like it's just there's no amount of there's no amount of safety you can guarantee with private bodyguards and blah 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 when you have teenagers or young people that don't have opportunity. They're going to try and find opportunity the ways that they can. And I don't think we should be stealing from them, but that's what we're doing so that older people can don't have to pay for their health care.